Hi, everyone. Welcome to our Climbing the Hill event on workplace violence. I just want to introduce our speaker today. We have Greg Gisanis, a former member and head of the AAEM RSA Advocacy Committee. He also just graduated from the University of Maryland residency and now works in the community in Latham, Maryland. And we're really excited and honored to have him here today. So I'll turn it over to you.
All right. Thank you so much, Erin. Yeah, she mentioned I'm Greg Gisani. I used to be the head of the AAEM RSA Advocacy Committee, a position that I held for about a year and really enjoyed. Got to do a lot of good work done. It's now in great hands with Erin and Kirsty, and I'm sure they're still doing good work over there. But they've asked me to speak tonight in advance of HPEM, which is definitely an honor. And what I want to talk to you all tonight about is kind of how I found my own voice and began advocating on a topic that's very important to me, which is workplace violence prevention in medicine. So let's go ahead and get started. Oh, that didn't work. Sorry, trying to figure out how to advance my slides. All right, so I'm going to start. I think every good talk should start with establishing kind of what your credentials are or why you're qualified to talk on a topic. And so this is me doing that. Right here, you'll see a picture of me, and it probably doesn't look like much at first glance. It's just me in my white coat. I had just worked a 24-hour trauma shift right before this was done, so I probably look a little tired. And like a lot of things that have happened over the past year or so, it was over Zoom. You can see my background, and you might even be thinking, hey, isn't that the same background that he's speaking from right now? And you would be right. I'm speaking at the same spot that I did then. But what made this Zoom call different from a lot of other Zoom calls that I'm sure maybe a lot of us have been on recently is who else was on that call. And two other people who were on that call were these two people pictured here. And on the left, you have Congressman Joe Courtney, who is a Democrat representing the state of Connecticut. On the right, you have Senator Tammy Baldwin, who's a Democrat representing the state of Wisconsin. And what this Zoom call was actually a Capitol Hill press conference done virtually, of course, but it was for the passage of this bill in the House, the Workplace Violence Prevention for Healthcare and Social Services Workers Act. And I had actually been asked by members of Congressman Courtney's staff to talk on this at this press conference and to share my personal experiences with that issue. And I was a third-year resident at that time and never thought I would ever have such an opportunity while in residency or honestly at any point in my career. And HPEM seemed like a good time to share my story with you guys and kind of talk to you about how I got there and hopefully help some of you guys get there too. So the purpose of this talk is going to be like this treasure map. We're going to see how I got to X, and we're going to talk about my journey. So my objectives for this talk, a few things. First, I want to give some background about workplace violence and how prevalent it is, so maybe you can understand why it's so important to me. As with any good HPEM lecture, we're going to talk about the laws and legal precedents surrounding this issue, but then we're going to pivot a bit, and I'm going to share my story of advocacy with you guys and how I got the opportunity to speak at a Capitol Hill press conference. So first off, before anything else, I have no disclosures, just crippling student debt. Sorry, guys, when you become an attending, that doesn't just magically go away. I wish it did, but it doesn't. So let's talk about violence in healthcare. Just looking at the numbers, over 3/4 of workplace violence incidents that are reported to the Occupational Health and Safety Administration, occur in the healthcare setting. In fact, each and every one of us, by virtue of our career, are 4 times more likely to be a victim of workplace violence compared to our peers in other fields. And as startling as these numbers are, it's often underreported, with data suggesting that only about 26% of physicians and 30% of nurses even bother to report when they are assaulted. This is a graph from the Bureau of Labor Statistics showing rates of violent injuries that result in days away from work by industry. As you can see, the green line, which is healthcare, is well and above a lot of other, well and above any other really occupation that is listed. This graph, same thing, number of accidents by industry. And again, healthcare far and above a lot of others, even some ones that surprised me that I thought would be higher up, such as mining and construction. healthcare still beats them by a significant margin. So who's assaulting us? Again, according to the Bureau of Labor and Statistics, by and away, it's mostly patients who are assaulting us, accounting for 80% of the cases. But as you can see, it is not only patients, there are some other groups in here. And most surprising to me was that students actually made up 3% of all workplace violence injuries in healthcare. And listen, I know medical school was stressful, but I never felt the need to assault anyone, even on my worst day. Hopefully nobody on this call feels that way either, but just something that I thought was interesting. Looking at the emergency department specifically, our colleagues over at ACEP conducted a survey of their members back in 2018 to try and get a sense of how prevalent this was in our field. And what they found was truly shocking. 47%, that's nearly one in every other provider, had reported having been a victim of workplace violence. You can see here on the right, it breaks down pretty evenly among men and women as well. There doesn't seem to be a gender difference in that regard. In fact, men are actually a little more likely to be assaulted according to this data. How are patients assaulting us? Well, they're very creative, as with a lot of things. Most often they're hitting and slapping us, but as you can see, there are a lot of different ways that patients are choosing to visit bodily harm among us ED providers, and they're certainly not limiting themselves. Fortunately, nobody has reported being assaulted with a gun, which I'm very thankful for. So, looking at some of the laws that surround this issue. Looking at federal laws, the main federal agency that handles this is OSHA, the Occupational Safety and Health Administration. The General Duty Clause of the Occupational Health and Safety Act of 1970 puts the onus on employers to provide a safe workplace for their employees that is free from recognized hazards of the industry. In other words, employers are responsible for providing safe workplaces to their employees and for taking active steps to try and mitigate harm that may result in a certain field. Any injury that occurs in the workplace that results in treatment or days off must be reported to OSHA. And OSHA actually has the ability to do site inspections and levy fines. They actually, semi-recently, and I don't remember the year offhand, I apologize, visited Brookdale Hospital in New York City and fined them for unsafe working conditions. There are some shortcomings to this when it comes to workplace violence. There are no clear standards about what active steps for workplace violence prevention actually entails on the part of their employer. OSHA does have guidelines for preventing violence in the healthcare setting, and they're actually very valuable, and I would encourage you all to read them if you have a chance. But unfortunately, that's all they are. It's guidelines. They don't create any legal onus on the part of the employer, on the part of the healthcare employer, to take active steps to try and mitigate violence in the healthcare setting. And you could argue that it's not enough. And in fact, the Government Accountability Office has argued that, and they've recommended that OSHA increase education and enforcement of workplace violence prevention for healthcare. It remains to be seen what if anything, will come of that GAO recommendation. State laws, as you can imagine, they vary by state. In fact, it depends on your state whether it's even a felony to assault a healthcare worker. I live and work in Maryland. In the state of Maryland, it is not a felony to assault a healthcare worker. It's actually only a misdemeanor. However, it is a felony to assault a bus driver or a public transportation worker, which I think is unfortunate. Interestingly, there are 10 states: Maryland, Connecticut, New York, New Jersey, Maryland, where I live and work, Illinois, Washington, Oregon, and California, that do have workplace violence prevention laws. Basically, they have laws on the books that say that healthcare organizations are responsible for developing and implementing workplace violence prevention plans to try and keep their employees safe. Again, those 10 states have that law. The others don't really have anything equivalent on their books. So that's a brief background about the issue and why it's so startling and sobering. And now we're going to talk about how I got into advocating for it. So The early days of AAEM RSA. So I joined AAEM RSA my intern year, and I joined the advocacy committee. I know there are a lot of people in the committees and in AAEM RSA who get in as students. Unfortunately, that was not the case for me. I didn't even really know too much about RSA when I was a medical student, but heard about it intern year, joined the advocacy committee and became a member. I published a few articles in that first year that mostly wound up on the AAEM RSA advocacy committee website. They're probably still there. There was one on gun violence. There was one on human trafficking. I think there's one or two others that I can't remember off the top of my head. But it was fun and I liked doing it. But then I actually, through the work that I did, my chair at the time, Gabe Stahl, who some of you may know, actually contacted me towards the end of the year and asked me if I wanted to speak at HPEM. This was in 2019, my intern year. This was pre-COVID, so I'm not wearing a mask, as you can see. But there's a picture of me actually. The lecture was on gun violence, and I was talking about, I guess, the Dickey Amendment, according to this picture, which, if you know anything about gun violence, you'll know what that is. But an amazing opportunity for me, and again, not something that I thought I was going to have the opportunity to do that early on in my time with AEM RSA. But I think the takeaway from that, and as I go through this, I'm gonna offer various takeaways at different points along my personal journey, but is to really be active in your committee. As Aaron said, I was the chair of the advocacy committee for a year, and I can tell you from that time that while there were a lot of people on the committee in paper, the number of people who were actually engaged and came to the meetings and produced things for the committee was actually a lot less. And I get it, being active in a committee isn't for everyone. But if you are, it can be very valuable, and it can certainly lead to many opportunities that aren't initially obvious. And that certainly was the case for me. I think me being asked to speak at HPEM was directly related to the work that I had done with the committee throughout the year. So if you are in an AAEM committee, don't just, be a passive member, be an active member, because it can certainly lead to good things down the road for you. So I went to HPEM. I gave my talk, and then afterwards, there was a little, I guess, happy hour, social hour, I forget what they called it, where we got to meet and mingle. And I struck up a conversation with this gentleman, who some of you may recognize as Dr. Gary Gaddis. He is a professor of emergency medicine at the Washington University in St. Louis. And I think he actually recently retired after a very long and illustrious career. So congratulations on that, Gary. But he and I got to talking, and we started talking about workplace violence in the emergency department. And we both realized, we both felt very strongly on this issue and felt that not enough was being done, on the local, state, and national level to keep us safe in the emergency department. And, we both walked away from that meeting going, we should really do something about this. And so we were going back and forth on what we wanted to do. We decided pretty early on that we wanted to write something. And Gary emailed me one day and he said, "Hey, have you heard of this bill?" And it was HR 1309, the Workplace Violence Prevention for Healthcare and Social Services Workers Act. He said, "This bill is in the House right now. If passed, it would require every healthcare organization in the country to develop a comprehensive workplace violence prevention plan for their employees, similar to the laws that the states have that we discussed earlier, but on a national level." And I said, "No, Gary, I hadn't heard of this, but this is pretty neat. Maybe we should write in support of this." And so we decided that that's what we wanted to do, to bring some attention to this little known bill. And so we wrote an article that appeared in Common Sense. And this was either I think it was 2019 or 2020, but we wrote an article in Common Sense in favor of HR 1309. And takeaways from that is, don't advocate alone. Advocacy, as I'm sure you'll learn or hear from HPEM, advocacy is most effective when it's done in groups. And mentors are crucial as well. I would never have gotten to where I am without that chance meeting with Dr. Gaddis, because I honestly probably wouldn't have never heard of the bill if it weren't for him. And, in writing that article, and even to this day on a whole host of issues, not even related to that, Dr. Gaddis has been a huge mentor to me and provided me with invaluable advice and perspective. And so, as all of you are going through your advocacy journeys, don't do it alone. Find someone or some people who can be mentors to you, because it really helps a lot. So I began reading more and more about HR 1309 even after that article was published in Common Sense, because I was interested in it. And I found a letter that the American Hospital Association had written to Congress on the bill. And this is how they start the letter. On behalf of our nearly 5,000 member hospitals, health systems, and other healthcare organizations, our clinical partners, including more than 270,000 affiliated physicians, 2 million nurses, and other caregivers. That was how they started the letter. And then they went on in their letter to detail why they thought HR 1309 should be defeated. This letter was not they were not in favor of this legislation. But reading that how they opened that letter, that opening where they claimed to speak for, 270,000 physicians, made me feel like this. It made me angry. And the reason it made me angry was they were claiming to speak for me on an issue and saying something that I wildly, wildly disagreed with. And so, takeaway from that is that if there is an issue that is important to you, you need to speak up on it, or someone else is going to speak up on it on your behalf. They're going to claim your voice. And honestly, you might not like what they have to say on your behalf. So it's incredibly important that you speak up on these issues that matter, impact, and affect you. And so while I was angry and stewing, I thought, all right, they've said this, they've put this out there. What can I do to counter it? And the thing I realized was that although, I liked the article that Gary and I had written in Common Sense, the one problem with Common Sense is that only physicians read it. You don't have a large reach beyond the emergency medicine physician community by publishing in Common Sense. And what I realized is if I wanted to truly advocate on this issue, if I really truly wanted to guide the conversation, I needed to go a little more mainstream. I needed to publish in a venue or an outlet where more members of the general public would have the opportunity to read my thoughts. And so I got together with a friend of mine who I had gone to college with, who is a dermatology resident, and discussed the bill with him. And he and I put our heads together and we wrote an op-ed in favor of it. Except instead of sending it to Common Sense, we started shopping it to a bunch of different newspapers. And that may sound, fancy and exciting. It's really not. Most newspapers have very easy instructions for how to submit op-eds. They either have an online form or they have an email address where you can send your op-eds. It's really not a complicated process. Anyone can do it. The reason I bring that up is I've had a lot of people, when I said that I've written op-eds, they think, oh my gosh, that must be so hard. How do you do that? Who do you know? The answer is I don't know anyone. I just find the form or the email address online and I send it in, but that's an aside. So my buddy and I, we sent around our op-ed to various outlets, got a lot of rejections, unfortunately, from some of the bigger ones like the LA Times, USA Today, the New York Times, and the Washington Post. But then, because I live in Baltimore, I decided to send it to the Baltimore Sun, and they actually ran it for us. And this is it. It's called "The Dangers of Being a Doctor: Threatened by Those Who Seek Help," and there are names on the bottom, and you can see it ran in early January of 2020. And this op-ed discussed some of the challenges of being a doctor and the threats that workplace violence poses to us, but also towards the end, really advocated for HR 1309 and laid out a case for it. And so takeaways from that is that local papers really like publishing local authors. Again, some of the national newspapers weren't really interested in our op-ed, but the Baltimore Sun was, because I said when I emailed them that I was a physician in Baltimore. And when they responded to me, they actually said, "We're really happy to hear from you. Thank you for publishing. We love hearing from local physicians on issues that are important to them." And so to any of you listening out there, whatever your whatever community you live in, city, town, community, I guarantee it has a paper. And you should, if you're so inclined, I would highly encourage you to publish in that. Since in the time since I published that op-ed in the Sun, I've written many more. I actually have a good working relationship with one of the local newspapers for the paper for the county that I work in. So, a little smaller than the Baltimore Sun, but he lets me contribute fairly regularly to his paper, which has been a wonderful opportunity. And again, he gets a local author and I get to make an impact in my community. So local papers like local authors. Again, no matter where you live, I guarantee there's a paper that would love to hear from you. And this probably goes without saying. Physicians are a valued voice in any community. By virtue of the MD or DO after your name, you will lend a very credible and authoritative voice to any issue that you choose to weigh in on. So please, bear that in mind. So my buddy and I, we published this op-ed and we thought, oh, that's fun. It'll be a neat line on our resume. But that's, really going to be about all that comes of it. And so you can imagine our surprise when a few days later, we received this email. You can see it's from a woman named Maria Costigan. And she's actually the legislative assistant with Congressman Joe Courtney, who helped write HR 1309. And I won't read the whole email for you, obviously, but she goes on to thank us for writing the op-ed. She says, they're really excited that two physicians have chosen to weigh in on this. And she actually ends it by saying, if you're ever in DC, please feel free to come by and meet the congressman, which my friend unfortunately couldn't get away from his residency, but I was able to. And I actually took her up on that offer. And this is a picture of me and Congressman Joe Courtney in his office on the Capitol. And it was pre-COVID, which is kind of weird to think about now. It feels like COVID's been going on forever, but that's why we weren't wearing masks and we're standing pretty close together. But I was a second year resident when this happened, and again, I never thought that as a second year resident I would be personally invited to meet with a sitting member of Congress, much less for anything that I had written. And there are a few takeaways from this that I want you to keep in mind. The first question that I had for Ms. Costigan when I actually met her in person was, how the heck did you find our op-ed? I didn't think that a congressman from Connecticut would regularly be reading the Baltimore Sun. What I learned is that congressmen and women and their staffers have alerts for their legislation. They usually set up Google alerts to track any time that a bill that they've introduced is mentioned, in a newspaper, in press, or really in any medium online. And that is how they had found ours. The day that ours got published, they got a Google alert because our op-ed had mentioned their bill. And something I didn't know and wouldn't have even thought about. But keep in mind that if you write it and if you mention, the name of a bill, the congressman or woman who wrote that bill will probably end up reading it. So, just something to keep in mind as you're thinking about what issues are important to you and how you want to weigh in on them. And so I met with Congressman Joe Courtney that day. It was very gracious, a very lovely conversation. And then the bill was introduced by Congressman Joe Courtney in the House, and it was introduced by Senator Tammy Baldwin in the Senate. And I didn't get a chance to meet with Senator Baldwin, unfortunately. The Senate had just finished, I think it's first impeachment hearing at that time, and they were trying to catch up on some of their other business. So Miss Senator Baldwin was unfortunately a little busy, but I did meet with one of her senior policy advisors, Mr. Michael Waskey, and I want to end tonight with something that he asked me. He said, "Where are the physicians on this?" He said, "We put this bill out several months ago. You know, a lot of the nursing organizations came on board pretty quickly and have been very vocal." He said, we haven't really heard anything from the physicians. And before your op-ed, you know, we were wondering kind of what they thought about this. And that stunned me, to be completely honest with you. Here's some legislation that, in my opinion, would do nothing but benefit us. And you know, whether it would have this effect or not, it's trying to keep us safer at work. You know, I think in terms of intentions, it's in the right place. And they were the staffers on the Hill were genuinely wondering why more physicians weren't speaking up on this. And again, you know, I couldn't believe it, but I think that speaks to the fact that we as physicians don't always do the best job of this, but we owe it to ourselves and to our colleagues when there's an issue that we are passionate about, that we think would either, you know, keep us safe, help us professionally, or equally importantly, help our patients. We owe it to ourselves and to them to advocate and lobby fiercely for it. And so my final takeaways before I wrap up is that your elected leaders want to hear from you. And most importantly is that your voice really does matter. Again, guys, I was a resident when all of this happened. You know, I'm not a resident anymore, but I've been a resident pretty recently, and I know how sometimes it can feel like you're at the bottom of the totem pole and that your voice and your opinion doesn't really count for a whole lot. And maybe in your hospital it doesn't. I hope it does, but maybe in your hospital it doesn't. In your state hall and on Capitol Hill, it does. By virtue of your profession and your title, you have a very authoritative and powerful voice that when you lend it to a conversation for an issue, your elected leaders will certainly stop and take heed. And I encourage you guys, each and every one of you, either listening to this now or listening to the recorded version later, to use your voice. Use it for your patients, use it for your colleagues. Most importantly, use it for yourself. Use it to advocate for things that will help you and will make your career better and safer. And so I'm going to pause now, ask if there are any questions. I think there is only one other person on the call, so if not, that's completely fine. But I figured I would ask.
I'll ask you some questions.
Okay, sounds good, Erin.
My camera's not working anymore and I can't figure out how to turn it back on. So we'll just
No
go with my
worries.
voice.
No worries.
First question I have is, why do you think it's important to get involved in advocacy early on in your career, just like you did?
Yeah, I mean, you know, I think advocacy is cumulative. You know, the more experiences you have, one, the better you're going to, oh, there's your camera. One, the better you're going to get at it. Just like with residency, you know, I was a much better physician when I was a third-year resident compared to when I was an intern. I think same thing, you're much better at advocating, you know, the more time you do it. Additionally, the more time that you spend doing it, the more contacts you're going to make, the more mentors you're going to meet. And again, that stuff just all builds. And I've been amazed at the number of opportunities I've gotten just based on, you know, simple random encounters like the one I had with Dr. Gaddis. And the other reason why I think it's very important, especially for residents to get involved, is there are a whole host of issues out there that really, really affect residents. And residents, you know, have a very unique perspective to lend to conversations for many, many different reasons, both by virtue of, you know, how they're trained and, you know, even things like how they're paid, you know, being paid by Medicare versus, you know, by a hospital. And I think that a lot of elected leaders don't necessarily know that. And actually, I can share a story to that effect. One of the representatives in Maryland, I think a year ago, introduced a bill to give hazard pay to healthcare workers working during COVID. And I called their office because I was a resident at the time, and as I'm sure you're aware, Aaron, we're paid by Medicare, not by the hospital. And so I called their office and I said, okay, you want to give hazard pay to healthcare workers. I think that's great. Does your bill guarantee that money for residents? Because we're not paid by the hospital, we're paid by Medicare, Medicaid. And I think the poor woman on the other end of the phone was just their secretary. And she said, I don't know, but I'll take down your concerns and pass them on to the legislative aide working on this issue. Never expected to hear back from them, but they actually emailed me and they said, wait, we didn't know that. Can you tell us more about, how you're paid and who pays you? And so, I exchanged a few emails with them. I said, look, residents are paid by Medicare, Medicaid, they give the money to the hospital who gives it to us. And they said, wow, we had no idea. If this bill ever makes it out of committee, we'll certainly put in an amendment that residents will also, be eligible for this hazard pay. And I think that highlights why it's important for residents to speak up because, like I said, we're not, I shouldn't say we anymore because I'm not a resident. It's an old habit. You guys are in a unique position that not many people are aware of, and you're your own best advocate.
That kind of leads to my next question. That was going to be what's the best way to advocate for like residents on this topic? And I feel like that covered a lot of it. If you want to add anything, that'd be great. But also, what do you think is the best way to discuss workplace violence with legislators? Like, what have you found is the most effective way? Is it like personal stories or anything like that?
Yeah, I mean, definitely. Sorry, what was the first part of your question again, Aaron?
It was kind of going back to what's the main way you think we should advocate for ourselves, like trainees on this
Mhm,
topic?
mhm. Yeah, I mean, I think with regards to workplace violence, the thing about the good and the bad thing about it is it affects everyone equally. It doesn't distinguish between men, women, and it doesn't distinguish between trainee and attending physician. So I think the way you advocate for that is going to be similar to how you as an attending would advocate for that. Depending on what state you're in, if you're in one of the 10 states like I happen to be, the way I've kind of advocated for it, at least within my own hospital, is I've gotten involved in the workplace violence committee at my hospital. And so, I use that position to try and advocate for things that I think will make my department and my colleagues safer. To go back to your question, the second part of your question, definitely personal stories. You know, I think that COVID has generated a lot of goodwill for healthcare workers among elected officials. Not that that shouldn't have been there already, because it should have been, but I think COVID did a lot of good for that. Um, but even pre-COVID, I found that personal stories go a long way. Healthcare unions, especially nursing unions, are very powerful. So if you can kind of bring in stories, a lot of elected leaders, even if you're the one saying it, they can picture their constituents. They'll picture their constituents who are doctors and nurses going through what you're describing. And so I've personally found that to be the most effective way. Numbers and statistics are great, but if you can truly make it personal for your representative, I found at least that goes farther.
Yeah, that's great. And I like that you point out that it affects everybody because even if it affects all of us equally, I feel like nurses are definitely the ones who are more likely to bear a bigger brunt because they spend so much time with the patients. So
Mhm.
I think especially relaying their stories and being advocates for them is super important as physicians because if it affects them in our emergency department, it affects us all. And I don't want the people who work with me to feel like they're unsafe. So I think it's really important to kind of voice that it affects everyone and not just us. I think that's great.
Yeah.
So kind of on that vein, how do you approach discussing workplace violence with your coworkers or trying to encourage them to notice certain things that are like when you mentioned spitting, it makes so much sense when you pointed it out. But had you asked me, that wouldn't have come to mind. I would have just been like, oh, okay, that happens. How do you get them to notice when workplace violence, especially the lower offenses that can often lead to bigger ones, are happening and to encourage them to report it where they might just brush it off before?
Mhm. One thing that I found personally in my practice, this goes back to advocating for other members of our staff, is that if a patient is being verbally aggressive to my nurses and to my staff, you may find this, Aaron. I found that a lot of patients, even if they're being aggressive to others, they'll usually be calmer when the doctor, me, walks into the room. But I've actually gone into patient rooms and had the conversation with them, and I'll say, look, I cannot have you yelling and using profane language to my nurse or my tech. And I think that does two things. I think one, it calls the patient out on their behavior and, maybe prevents them from escalating further. And I think two, equally importantly, maybe more importantly, is that it shows your staff that you have their back, that you are looking out for them. Um, when it comes to workplace violence, some people would consider verbal harassment a form of workplace violence. I think, a lot of us have the mentality of, oh, that's just part of the job. Honestly, I do, I would never think of reporting someone who is verbally aggressive. Um, in terms of how to encourage your coworkers, that is a very complex issue. I've met a lot of physicians, kind of in working through this issue, who hesitated because they didn't feel that they would have the support of admin. And I've heard stories of physicians facing some overt and some less obvious forms of retaliation from their administrators for reporting such instances. How you get around that, I have no idea. But I say that to say it's a lot more complex than just we need to, have more people report, because obviously that's the case. But unfortunately, there are a lot of other issues that go along with it. Me personally, I've never actually been in the department when someone's been assaulted. I've heard stories, and it certainly happened on days when I haven't been there. I've never actually been there when it's happened, which I'm very thankful for. I'm sure that streak's going to come to an end at some point in my career, just because of the numbers. Honestly, I don't know what I would do. You know, I think that, but I do think that's something that each and every one of us should ask ourselves is, how am I going to respond if and when, I or one of my colleagues is punched or slapped or spit on? Are you going to call the police? Are you going to get hospital security involved? Are you going to kick them out of the emergency department? Those are all things, and some hospitals will have policies on that. If your hospital doesn't, maybe that's something, again, advocacy, that you can advocate for the creation of such a policy, so that if and when it happens, you have something to fall back on, and to justify a course of action that you take. But it's a very complex question. I don't know if my answer did it any justice. Hopefully what I said made some sense.
No, it did. I think it's important to also just bring it to mind that it is the reason there hasn't been like one blanket solution to the whole problem is because it is such a complex issue. And then each place is different in their response to something. Maybe they're laid out protocols or just kind of, I don't know, like general tolerances of certain offenses, especially if you have a specific patient population compared to somewhere else. So yeah, I think there's a lot of things going on. And to emphasize what you said, where it's probably best to try to figure out how best to tackle it at your institution by discussing it with people at your institution, your attendings, your trainees, admin, people on committees, to figure out what is our process and how can we make it better? How can we implement a process if that's not going on? And are there any barriers to people successfully entering into the process to report something where they feel like they aren't supported or that something will be retaliation against them for doing that? So yeah, that's great. And the last question I had, I wasn't sure if this was applicable, so we'll see if you could actually answer this question. Now that we're like in the break of interview season and everything's going on with our current fourth years, soon to be interns, on this topic or any other like advocacy topics, can you think that you feel like it would be important if you were interviewing yourself again to ask during a residency interview?
Oh man.
This might
Um,
be a too out there question, so not to
no,
put you too much on the spot.
no, it's a very good question. I will say, when I was interviewing, this is a little different than what you asked, but hopefully it's applicable. When I was interviewing, certain programs will have specific advocacy things. Maryland, where I trained, Maryland had this like little extra certificate in, health policy that you could get. Some other programs have little advocacy things that they'll highlight on interview day. And I remember when I was a medical student, I put a lot of stock in that. I thought, oh man, this program is this. I should go there for that reason. And what I found is, honestly, those things that they'll kind of trot out for their interview day don't matter as much. You can advocate no matter where you are. Every hospital, every city, every town, every community is going to have issues that are important to it. And no matter where you are, by virtue of the title that you hold and the white coat that you wear, or maybe don't wear in the emergency department, but you have stuffed in your closet. Fun fact: I think that press conference I did was the first time I actually took my white coat out of my closet in my career, my residency career, and that was when I was in March of my third year. But you will have a voice in that conversation, no matter where you are. And Maryland did have that little health policy certificate you could do. I didn't do it. I didn't know anyone who did it in the 3 years that I was there. But I was still able to have these amazing opportunities. To anyone, I would say, go where you want and go to a program that you think you're going to get great training at. And all of the other things like advocacy, any other extracurricular you may be interested in will fall into place.
Yeah, I think that's a good point. I don't even have a full length white coat, like a true doctor one. We don't even do that. So I don't have one. But yeah, I think that's a good point. Like, especially like my residency, we don't have anything formal like what you were saying the University of Maryland did, but we have so many people who are super active in AAM and were active in AAM RSA, who are very forefront on lots of topics that are pertinent. And they're just here because they're good at what they do and they're passionate about it. So we don't even have anything formal. And I still think like I have lots of great avenues to access advocacy, especially being in a new state compared to where I was before, to kind of figure out what's going on. But yeah.
Yeah, there's always advocacy opportunities, no matter where you are. And for me, I found that kind of the local paper was a great avenue to get in. It worked well for me. There are a lot of different avenues out there to go in. There's podcasts and I don't even know what else. But just because print worked for me, there doesn't mean it's going to work for everyone. But if print's not your thing, I guarantee there's a medium out there that you can get involved in and make a difference.
Yeah, I think that's great. I love the local paper bit because there's so much issue with misinformation about a lot of things going on in medicine right now. It's nice to be able to disseminate your information in that way, where hopefully it might reach a few people that might not get it from other sources or might think about it differently because you're their local doctor talking to them about local issues that matter to them. I feel like it's a different kind of weight to that.
Absolutely.
Well, thank you so much, Greg. This was
Absolutely.
fantastic. I
And
loved your little points of guidance throughout your presentation. That was delightful.
yeah,
Yeah,
it was helpful. Hopefully someone learned something. I just have like one or two more slides, Aaron,
yeah.
and then I'll wrap up. So finally, just a few people I want to thank. Thank you to AAEM and the RSA, particularly my old stomping grounds with the Advocacy Committee. Sarah, my son Monty, who was born a few weeks ago. Maybe you heard him in the background crying, hopefully not, but he definitely was. And my two dogs, Brandy and Hayden. And then for all of you at HPEM, it's incredibly important what you guys are doing. I wish I could be there in person with you. Sadly, with the new baby, I can't. Hopefully you all understand why. But keep up the good work, have fun with each other and with your legislatures. And I mentioned earlier that, you need mentors. And Gary was Dr. Gaddis was my mentor. I am certainly not conceited enough to think that I am anywhere as near good of a physician or a mentor as him. However, if anyone is, dipping their toes into advocacy and would like some guidance, this is my email address. I check it fairly regularly. Again, I just had a kid, so I might not be as responsive to your email as I would have been previously, but please feel free to reach out. I am happy to help in any way that I can.